My name is Dr Bob Ryder from Birmingham in the United Kingdom, and I'm comparing here 9-month versus 12-month implantation of EndoBarrier in the worldwide EndoBarrier Registry. These are my disclosures, and this is an EndoBarrier, a 60cm impermeable sleeve implanted during a simple endoscopy procedure into the first part of the small intestine, such that the food passes through it rather than the small intestine, and it mimics the bypass bit of the Roux-en-Y bariatric surgery procedure. In view of uncertainty about the risks versus benefits of EndoBarrier, during 2017, an independent, secure online registry was established under the auspices of the Association of British Clinical Diabetologists with a collection of safety and efficacy data of EndoBarrier treated patients worldwide. The latest analysis of data in the registry was published in Diabetes Care in April of this year. Many of the serious adverse events associated with EndoBarrier occurred during the last 3 months of treatment, and therefore reducing the period of implantation to 9 months may reduce the complication rate. So we aim to assess here the safety and efficacy of 9 months versus 12 months implantation using data in the registry. As of May 2023, data have been entered on 1,068 EndoBarrier treated patients from 35 centres in 10 countries, and of these, 196 had both 9-month and 12-month data entered, and this is the data being analysed here. This is the baseline demographics of the patients, and I point out in particular the BMI mean of 40. And this is what happened to haemoglobin A1C and weight, and I point out in particular that there's no significant difference in the fall in weight or in the fall in haemoglobin A1C between 9 months and 12 months implantation. The greater the haemoglobin A1C, the greater the fall, with a mean fall of 3% or more if the baseline haemoglobin A1C is greater than 10%, but again, no significant difference between the fall in haemoglobin A1C between 9 months and 12 months. And obviously, the particular question of interest is how many serious adverse events would be avoided by reducing the implantation time to 9 months. In the full registry, there were 45 serious adverse events at a 4.2% rate. All the patients with a serious adverse event made a full recovery, and most experienced benefit despite the serious adverse events. But it was noteworthy that 15 of the 45 would have been avoided by removal at 9 months, and that was 9 liver abscesses, 5 GI bleeds, and 1 cholecystitis. It was particularly noteworthy that 9 of the 14 liver abscess serious adverse events would have been avoided by removal at 9 months. This is a table of the serious adverse events. You can see there that 15 out of 45 occurred after 9 months, and 9 liver abscesses occurred after 9 months. So in summary, the data confirms the effectiveness of EndoBarrier at reducing weight and haemoglobin A1C. The higher the baseline haemoglobin A1C, the greater the fall, the mean fall of 3% if the baseline is greater than 10%. Reducing the implantation period from 12 months to 9 months resulted in no significant difference in weight loss or improvement in haemoglobin A1C, a 33.3% reduction in serious adverse events, and it was particularly noteworthy that over 60% of the liver abscesses would have been avoided by removal at 9 months. These data support a change in the recommended implantation period from 12 months to 9 months. As endoscopy units are ubiquitous, delivery of EndoBarrier treatments could be relatively straightforward. And now I'd like to share with you some of my patients, and you can see this gentleman by 9 months had reduced his haemoglobin A1C from 12.1% to 5.8%, and he'd lost 23.1 kilograms. This lady had lost 17.3 kilograms by 9 months, and as well as the improvement in her haemoglobin A1C, her alanine aminotransferase level as a marker of liver fat had normalized. This lady was on continuous positive airway pressure ventilation, or CPAP, for obstructive sleep apnea. By 9 months, she'd lost 14.1 kilograms, a considerable reduction in her insulin requirements, and she no longer required the CPAP. This lady, by 9 months, had lost 12.4 kilograms. Her hemoglobin A1C had fallen to 6.8%. There was a considerable reduction in her insulin requirement, and her renal function had normalized. This lady had a massive reduction in her requirements for insulin through the 25.2 kilogram weight loss by 9 months, and by that time her hemoglobin A1C was 6.3%. And finally, this lady, by 9 months, her hemoglobin A1C had fallen to 6.8%, and had she had her EndoBarrier removed at that point, she would have avoided having a liver abscess. I thank you for your attention.